Ladies and gentlemen, we are here for growing some awareness among the lay people regarding cancer. And a few of the weeks, last few weeks probably, 3 to 4 weeks, we have been decided that we will go through in English. As because there are so many people who can better perceive English or Hindi or bilingual. Thinking about them, we have decided that 3 to 4 programs we will telecast on English. For that reason, we are doing our today's program on English also. Today we will discuss on head and neck cancer, the most common cancer or the commonest cancer in India, and in world 75 to 80% men specifically have been suffering from head and neck cancer. We'll talk elaborately, and you just seen that there are 2 big TVs and we have depicted there everything so that you can comprehend or understand every minute details of head and neck cancer. In our scroll, we have given the symptoms, mainly the cardinal signs and symptoms, the red flag signs and symptoms. That will basically tell everything on behalf of head and neck cancer. The rest of the thing, what I would like to take, that is the statutory warning, smoking, or specifically the culprit is tobacco. Tobacco in any form is the main culprit of head and neck cancer. And in India, there are so many things. Government has taken so many steps, but tobacco cannot be eradicated. That has come to us as a sin. Some people are conscious, but most of the people not very conscious. They're summoning head and neck cancer silently. They simply do not understand what the crime they are doing on behalf of themselves or towards the society. That is literally crime. So the statutory warning will be, any form of tobacco should and must strictly be prohibited. Any form of tobacco. It may be smoking, chewing, or anything else, even betel leaves also. I am just transferring the camera to one of the most eminent clinical oncologists now in Calcutta, Dr. Tanmoy Mandal. He will tell the rest of the things on controlling regarding prognosis, screening, etc. and what you should do and do not. Every detail he will tell on head and neck cancer. Again, I am reiterating that tobacco is the main culprit of head and neck cancer. Any form of tobacco should and must be strictly prohibited for yourself, for your son and daughter, for your family, and for the society at large. I am just transferring the camera to Tanmoy. Tanmoy, let's start.
So as we all know that head and neck cancer is the most common cancer in India. Males are mostly affected, that is right. Even if we say that head and neck cancer is even much more commoner than the incidence in UK or US or in the Western countries. So the incidence in India is even much higher than the Western countries.
Definitely.
And the most important reason is smoking, because 75% of the cases of head and neck cancer is due to smoking. So
smoking or chewing tobacco,
any form of tobacco, tobacco is the most important culprit. It causes around 75% to 80% of the causes of head and neck cancer is due to tobacco in any form. So if we know that in developing countries the risk of head and neck cancer is increasing, the reason is mostly tobacco. And if we know that in males it's more common, of course in males it's more common than in females. In males it's around 1 in every 33 males are affected in India, whereas 1 in every 100 females are affected in India. So the female incidence is less, but the male incidence is more, and that is very common because the use of tobacco is more common in males. That's the most common explanation for
Even
this.
in the villages also.
Yes.
There are so many studies that village people are consuming more tobaccos than the cities.
Yeah, of course. So, but still there is some geographical differences also. Means demographical parameters are there. Suppose if I say in the northeast part of our India, that's the capital of head and neck cancers. What we see that the incidence of head and neck cancer is even more in the northeastern part. And if we know that Mizoram, Manipur,
That
these
is
are
due to probably betel nut.
betel nut. This is mainly due to the betel nut, which they use.
This is a
Aizol.
poison.
This is Aizol. If you take into account this Aizol, that is a place in I think Mizoram or Manipur. But there
Even
also,
Assam also.
yes, there also the incidence of head and neck cancer is at rise.
As because profusely they are taking betel nut. Betel nut.
Yes,
Yeah.
betel nut.
Not betel leaves.
Yes, betel nut.
Betel leaves are rare. But betel nuts are very common in Eastern India. Northeast India.
Northeast India.
Specifically.
So that is the reason why it's very common in India. So what are the other causes of head and neck cancer? So if we tell that around 75% patients are due to smoking or tobacco, remaining 25% are there. So what are the other causes? That also we need to know. So one of the major other cause is human papillomavirus. That's also associated with many head and neck cancers. Other causes are alcohol, some immunodeficiency states like diabetes or other malignancies or HIV. These are also, they may be associated with head and neck malignancies. So what is the difference between the head and neck cancers in India and the head and neck cancers in the western part of the world? So what happens in western part of the world, the patients are mostly HPV associated or human papilloma virus associated. So if they are human papilloma virus associated, it's mostly a good biology tumor. Means the human papilloma virus associated are not that much aggressive as
In comparison to tobacco related
cancers. So the human papilloma, if we know that it's associated, it's due to human papilloma virus, it's a better histology or it's a better prognosis.
And the prognosis is good.
Good, rather than due to smoking. So what happens is that in India, the patients presents late, mostly because of unawareness, because of
And
society,
there is
social norms.
Sure, there is a lesion in mouth or lips or elsewhere, but the person is not very aware
The person
that it
is-
may be cancerous.
Yes. So what
He
happens
doesn't
is
even
that-
bother. He is taking tobaccos.
So if there is a lesion or even ulceration in the ear, in the tongue, they present to a dental surgeon or even a general surgeon. It has been prescribed medicines and the tongue.
When you were told just ear, there is an earache also.
Yes, there is earache
Ear
because,
infection.
because of the reason, because the retromolar trigone, the back part of our oral cavity, if that is involved due to chronic chewing, so that causes
Earaches.
stiffness in this movement or opening of the mouth. That is known as trismus. This
Trismus.
leads to earache. So this leads to
Trismus.
earache. So earache, chronic
Opening
earache
of the jaw even.
is restricted.
Ah.
That's one of the major signs of oral cavity cancers or cancer in the retromolar trigone. So that's one of the major symptoms or signs what we see. So what I was discussing is that in India, the patients present very late when the tumor grows such a big ulcerative lesion. So this, because the surgery is the mainstay of treatment for a head and neck cancer in any stage, in most of the stages. So if the tumor grows so big that it becomes an inoperable tumor, that's bad. So there comes the role of awareness, screening. So
And mostly the etiology
is tobacco.
tobacco.
So
When people will understand, I simply do not know for what reason they are smoking or chewing tobacco. They are endangering their own lives, associated with others, and even the society also. Passive smoker also, there is a chance of getting infected by head and neck cancer.
yes. So what happens is that a small ulcer can be presented to a surgeon. It might be biopsied, it might be operated if required. But rather than presenting in a small state, they present when it's very big. A small ulcer in the buccal mucosa or oral cavity.
Now,
or
everybody
tongue
thinks that it will one day it will go away,
go away.
but it will never go away. That is the problem.
So we need to be cautious. That's very important. We need to be aware. We need to visit the doctors because we need to get a biopsy done if it is required. And keep in
If
mind,
there is a very small lesions, I think, I don't know whether you will be eye to eye with me, but the patient or the person should be cautious.
yes,
And nowhere you should go. You just go to a medical oncologist like Dr. Tanmoy. He will define everything, whether it will be dangerous for you, whether it will be malignant, whether it will be cancerous or not. Everything will be determined by Dr. Tanmoy Mandal, medical oncologist. A very small lesion. Again, I am reiterating.
so what is the reason for high incidence of this oral cavity or head and neck cancers in India? One of them is late presentation because they are mostly unaware, or even if you ask that they don't want to
And they will continue chewing tobacco or smoking.
Even
Even
after-
there is a lesion, even it has been found.
still they will
After that, he will continue his smoking. He will never leave chewing tobaccos or smoking.
check. So that is one of the major reasons that it's the late presentation, late stage presentation, lack of access. So what we see that in the rural places in our country, there is lack of access to such.
Even in case of West Bengal,
Bengal also.
simply it is very difficult to get diagnosed also in villages.
Yes. So that is one of the next reason for why there is a higher incidence of oral cavity cancers in India. Third most common cancer is the biology. The biology is bad because we don't have higher number of human papillomavirus associated head and neck cancers. Rather than we have higher number of tobacco associated head and neck cancers, which is a poor biology disease by itself.
And which
That's
is more harmful.
Which is more harmful.
In
So this
layman's
is-
verbatim.
So this is the third reason why the incidence of head and neck cancers is higher in India.
And it's gradually increasing day by day.
Yes, and next is most patients are not able to complete the full treatment also because of
It's the saddest.
fund issues or because of financial issues or because of setup issues, access issues. So these are the reasons why the incidence of head and neck cancer is
Next,
higher.
the health issues also.
Yes.
At the last stage, when they are coming to you, you have nothing to do.
Yes, because see, it's oral cavity. Your feeding is jeopardized in most of the parts. See, if you have a tongue cancer,
If you can just open your mouth, if your jaws get clogged, how will you eat? So there will be a natural deviation.
yes. So the health goes down, the weight goes down, general
And
condition
it's very
deteriorates,
painful.
and of course the pain associated with head and neck cancers is too much. So these are the reasons why the incidence of head and neck cancer is too high in India.
For that reason, Tanmoy, we are showing this in our TVs. How much dread head and neck cancer may become, you will just perceive seeing these footages to shock you. Basically, we have decided to shock you. It's nothing but a shocking experience so that you can refrain yourself from tobaccos.
So next thing is, how does it present? So what are the symptoms of head and neck cancers? So see, head and neck cancer, what are the sites of head and neck cancer? One is the oral cavity, one is the oropharynx, one is the laryngopharynx and the hypopharynx. So So these are the three parts of the pharynx, and this is the oral cavity. So oral cavity has many subsides. Like it starts from the lip, then is the buccal mucosa, then is the soft palate, the hard palate, the tongue, and the floor of the mouth. So these are the subsets of the oral cavity. It can happen anywhere. Next, what we have also, we have the retromolar trigone and the mandible and the upper gingivo-buccal sulcus. So these are the sites in oral cavity. Next is oropharynx, is another part. Next is laryngopharynx. Laryngopharynx means the larynx, which is known as the voice box. The supraglottis, or the above the part of the voice box, is the supraglottis and the infraglottis. And the third last part is the hypopharynx or the pyriform sinus. So these are the parts of the head and neck, the parts where the head and neck cancer can happen. These are the subsets.
There is a famous Bengali film, Kantho, and some of our teachers also, Professor Abhijit Banerjee there, he acted there, and he just told how catastrophic it may become. His voice box is literally cut out.
So the presentations are also in the oral cavity. We have a lesion in the buccal mucosa. It can cause edema and redness in this skin. We have lesion in the tongue, which can cross the midline.
Lumps.
And we will also have neck nodes, which can also happen because these tumors spreads to the common neck nodes, the draining lymph nodes, which are the mostly the neck nodes. So tongue, we have the buccal mucosa, we can have a lesion in the floor of the mouth opening can be reduced, that is known as trismus. The retromolar trigone is commonly associated. Again, if we have disease in the oropharynx, you can have problem in deglutition. You will feel a foreign body sensation when you are swallowing the food,
swallowing or drinking
water. If you have a lesion in the larynx or the voice box, there will be hoarseness of voice. That's the most important symptom. There might be occasional cough if you have with bleeding, and if it is in the pyriform sinus, also we have difficulty in deglutition. So these are the common symptoms with which these patients present.
And we are talking about tobaccos. To some extent, alcohol is one of the culpritors.
Yes, alcohol is associated. Alcohol and tobacco are associated with almost all the cancers which we see day in, day out.
Tobacco is taking the lion's share. Next will come alcohol. So you must try to refrain from these two poison. That is the criminals. Two criminals that definitely will cause head and neck cancer today or tomorrow.
So next is one part which I left is the nasopharynx, which we can have, but nasopharynx, the incidence of nasopharynx cancer is not so high. It's a bit less.
Mainly the oral cavity.
Oral cavity is most very common, and nasopharynx is seen in some parts of the northeastern part of our country also. So next is how to diagnose. The most important step is a biopsy, and remember that biopsy will not lead to spread of the disease, because everyone has a feeling that biopsy might lead to increase in the disease, it might lead to spread of the disease.
Every day Tanmoy says the same things, like statutory warning. Biopsy is utmost necessary for staging of the cancer. If they can't stage the cancer right now, they will never be able to treat properly. And biopsy does not necessarily mean it will spread cancer elsewhere. So the take-home message will be treatment first will start from biopsy.
So diagnostic start is with the biopsy along with a CT scan of this part of the face and the neck, or an MRI of the face and the neck, along with the thorax, because the head and neck cancer commonly spreads up to the lungs. It generally or it rarely goes beyond this to liver and other parts of the body. It can go, but it's not very common. So it commonly spreads up to the lungs. So we do a CT scan of the face and neck along with the thorax. So this is the common staging investigation, and the biopsy is the diagnostic investigation. So after this, we need to decide. See, the surgery is the mainstay of treatment for all oral cavity cancers. So if the lesion in the oral cavity is surgically resectable, it should be the first modality of treatment, and we generally don't like to see a patient which is an unresectable tumor, because unresectable tumor is not a curable tumor in most of the situations, except for larynx and the hypopharynx or the oropharynx. The oral cavity, for oral cavity itself, unresectable tumors are the most painful tumors. So the surgery is the most important part for an oral cavity cancer. So if it can be surgically operated and removed, that's the best part of the treatment, which is done mostly by a head and neck surgeon, which might take the help of a plastic surgeon if required for reconstruction of these parts of the face. So after surgery, if the patient has been operated, we need to see the tumor size, the other parameters, and we need to evaluate whether the patient requires radiation. In some cases, he or she might require radiation plus a chemotherapy in certain situations. When the disease has spread to other parts of the body, or if it's not a resectable one. So if it's not a resectable tumor, that means it's an unresectable tumor. Radiation plus a chemotherapy is the treatment of choice for those patients. And lastly comes, if it's a metastatic tumor, that means it has recurred or it has spread to the other parts of the body like the lungs or the other parts, then it's mostly a metastatic or a stage 4 or an advanced head and neck cancer. In those cases, what we do, we treat with systemic therapy in the form of chemotherapy, with targeted therapy in certain cases, with immunotherapy in certain cases. So the treatment is mostly systemic in the form of all these things. Just one part I need to give a special mention is that if the malignancy is within this larynx or in the hypopharynx or in the oropharynx, the treatment of choice is not surgery, and it's radiation plus chemotherapy is the treatment of choice in most of the patients. Larynx may be removed by surgery, but that's in mostly advanced cases of laryngeal cancers, because voice is the major part. So we need a voice preservation is the most important goal in laryngeal malignancies. So voice preservation can be done with radiation, not with surgery. And the last topic which I want to deal is prevention. Why, what to prevent, how to prevent. Most important statement is to avoid tobacco. That is the statutory warning what everyone feels. Tobacco is the most important point which we need to practice. We need to maintain a good oral hygiene by the use of brushing of the teeth, with the use of other things. Oral hygiene is one of them. HPV vaccination, although it helps in the treatment or in the prevention of cervical cancer, it can also help in the prevention of head and neck cancers, although the incidence is good. And of course, betel nut chewing, that's one of the part which we need to see. So these are the things by which we can prevent. And the most important take home message, anytime, at any point, you see an ulcer in the oral cavity, reach the doctor. Or you have a hoarseness of voice, reach the doctor, get evaluated, and then plan for further treatment if required.
Two things. From Tanmoy's discussion, he has very easily told everything on head and neck cancer. Two things. First one is tobacco and alcohol. Second one is oral hygiene. But the thing is that wherever we have discussed in our early sessions, Tanmoy repeatedly told that tobacco is the main culprit of lung cancer, to some extent breast cancer, and head and neck cancer also, even in cervical cancer also. So tobacco, chewing or any form of tobacco should and must be prevented. If you just cannot refrain yourself from tobacco, death is dancing in front of you. Just try to remember, it's like Bergman's seventh seal, the famous scene you can remember. The death is dancing in front of you, and tobacco will summon up all these energies. Next Sunday will be coming at the same time. In the meantime, we do hope that will be to some extent very good with your family. Ever, if you find a lesion in your mouth, run amok to Tanmoy like medical oncologist. Bye bye. Have a nice day.